Welcome, ladies and gentlemen. I'm Dr. Silva. Thank you for joining me for this talk on dry mouth, xerostomia. The mechanism by which medications dry the mouth is by blocking the actions of acetylcholine, a neurotransmitter that's necessary for a lot of our digestive functions, including the motility of the GI tract. Medications that block acetylcholine at the level of the gut cause constipation. Acetylcholine is also necessary for salivation. Saliva is important because it has antimicrobial actions. It helps to prevent cavities, as well as preventing an opportunistic fungal infection called oral candidiasis that's also seen in immunocompromised states. Saliva acts as a buffer to acidic foods, and it helps to prevent acid erosion, the demineralization of teeth. It also lubricates the mouth. It keeps it moist and feeling comfortable. Dry mouth, xerostomia, is very uncomfortable. If it's severe, your tongue starts to stick to your palate, and your lips start to stick together, and you get all this crustiness. It's pretty bad. Chronic dry mouth can also lead to a fissured, lobulated, erythematous tongue. And it obviously also lubricates the food as we crush the food with our teeth and chew it. And then it helps us swallow. And it also contains a digestive enzyme, salivary amylase, so that we begin to digest starch in our mouth before the food is even swallowed. So there are digestive and antimicrobial actions in addition to comfort. When patients complain of xerostomia, though, they're not complaining of their increased risk of having a cavity or the fact that bread has to wait until it reaches the small intestine to start to be digested. What they're complaining about is discomfort, because it is very uncomfortable. And many times people that are on more than one medication that cause it get a synergistic effect. In fact, polypharmacy is usually the culprit. Polypharmacy meaning being on a lot of medications. A lot of times the connotation is that you're on too much medication. Polypharmacy has a negative connotation, but this is especially true in older individuals who are more vulnerable to dry mouth because as you age, you produce less saliva. There's an age-related reduction in saliva production, but also they're more likely to be on multiple medications. Most young people don't even take medicine. So the older you get, the more medications you're liable to be on, and it's very common. There are lots and lots of anticholinergic and sympathomimetic medications out there, hundreds and hundreds, over 400 identified medications that can dry your mouth. Individuals who smoke marijuana are very familiar with cotton mouth. Marijuana just all by itself is highly anticholinergic. In fact, it causes the most severe dry mouth that I've seen, and I've experienced it myself many hundreds of times over, so trust me on that. There's also dry mouth that's associated with medications that increase epinephrine and norepinephrine, sympathomimetic medications. But here again, the actual xerostomia is ultimately caused by the inhibition of acetylcholine release by norepinephrine. Similarly, when a person is nervous or otherwise keyed up, riled up, angry, for example, there's increased sympathetic nervous system outflow, increased adrenaline, and that's characterized by the release of epinephrine or epinephrine, and the mouth often becomes dry. I'm not nervous right now, but I am recording, and so I'm a little bit keyed up, and so the dry mouth that I have because of my medications is worse when I am recording. And I usually edit that part out, but it's very germane, so I'm going to leave it in place right now. I want to talk about too, also that opiates famously dry out the mouth, both opiate medications that are derived directly from the poppy flower itself, and opioid medications. Opioid medications being synthetic opiates. Collectively, the narcotic class of medications. Narcosis, by the way, means sleep. And so narcotic medications, when we say narcotics, we're talking about the opiate family of medications. We're not talking about cocaine, we're not talking about meth and all the others. A lot of times people think narcotics means illicit drugs. It doesn't. It means the opiates because they cause narcosis. They cause you to fall out to sleep. But narcotics also dry out the mouth by interrupting a person's baseline salivary secretion. And speaking of sleep, there's decreased saliva production during sleep, which sometimes leads to a transient dry mouth for a lot of individuals in the morning. Or halitosis, bad breath, which is due to the tongue being coated with odor-causing bacteria. You can avoid this by scraping before you go to bed and using an antimicrobial mouthwash, and then scraping and rinsing again in the morning. Because what usually happens when you have a normal amount of salivation, even though it's decreased during sleep, you're still swallowing it. You're swallowing the saliva and you're washing bacteria off your tongue. Some accumulates anyway, but when your mouth is very dry, then you don't have that rinsing action. You wake up in the morning, your tongue is not only dry, but it's coated. You can see it's white and it's coated with bacteria, and when you scrape it off, you can see it. So anyway, everybody should scrape a little and use a little mouthwash to get good oral hygiene, but especially if you have dry mouth. Because the problem is that your baseline salivary production is diminished. This is important. Your mouth isn't dry when you eat or when you drink. That stimulates the salivary glands to produce saliva. So it's not like medications prevent you from producing saliva. It's just the baseline production. And so when you eat and drink, you're okay. And even thinking about food can cause you to salivate, as in that famous Pavlovian experiment that we all know about with the bells and the salivating canines. You will salivate. It's harder to do by just imagining food, especially if you're on medications that are either halting or markedly diminishing your baseline level of secretion. When production is reduced by about 50%, the sensation of dry mouth results. And just as an aside, one other thing that causes salivation is stimulating the gums by flossing. When I floss at night, and I've got dry mouth because of medications, but when I floss, I have to spit. I produce so much saliva. And I told that to my dental hygienist one time, and she had a light bulb moment. I could just see the light bulb going off. She was like, yeah, oh yeah. So anyway, what I hear a lot from patients is, well, I'm just drinking a lot of water. When I ask them, they tend not to complain about it. I ask them if they're having dry mouth, because I assume they are a little bit, and then they do acknowledge it, but they tell me that they're just drinking more water, which is great. Drinking water is a good thing, unless you have a specific medical contraindication for drinking too much water. If you have some condition like congestive heart failure that's going to cause you to be volume overloaded, then you don't want that. And otherwise, though, I always encourage my patients to drink as much water as they can. Again, certain conditions where you wouldn't want to do that, but drinking water is not a complete solution, because after you've swallowed the water and it evaporates, you're still left with the dry tongue and dry mucous membranes, because the baseline level of secretion just isn't there. And so a better thing to do is to combine frequent sips of water with a sugar-free lozenge. You can also use sugar-free gum as well, but that's not always conducive to be chewing gum. So I tend to not recommend that a person be chewing gum all day. Once you lose the flavor, you have to find a place to put it. Regardless, it needs to be sugar-free to prevent cavities, because you may have a lozenge in place for most of the day. The best products on the market, you see, I usually cut this out, but I'm not doing it on purpose. I actually need water, but I'm also talking a lot. The best products on the market also have built-in humectants, so that not only is the lozenge causing you to salivate, thereby moistening and freshening the mouth, making you more comfortable and restoring your oral hygiene and normal oral physiology, but it also coats the mucous membranes and the tongue, and so it provides more lasting relief even after it fully dissolves. There are a lot of other products out there, mouthwash and toothpaste for dry mouth and such. I don't recommend any of those. The claim with the mouthwash is that you have to use it continuously, daily, for 4 months, and then you might get up to 4 hours of relief. But my first thought would be that by 4 months, many individuals have developed at least some tolerance to the xerostomia, because one does develop tolerance. So you might still have some dry mouth, or it may be gone completely. That for me is a confounding variable. And then you may get up to 4 hours. That could mean 30 minutes. What are you going to be doing? You're going to carry mouthwash with you all day long and rinsing. It's just not convenient, really. So the only thing that ever really worked for me were the lozenges. And of the 2 major brands, which shall remain nameless unless one of them sponsors me, I prefer the cheaper one. One is way cheaper than the other. So compare the prices, and especially if you buy it in bulk. If you buy the big thick box, I think it's got 48 lozenges or 36 lozenges or something like that. This is a dose-dependent side effect, so lowering the dose is always an option. But if that's counter-therapeutic, at least holding at that dose for a few weeks, if that's feasible, and waiting for some tolerance to develop before increasing again is another useful strategy for mitigating the severity of this side effect. When I started taking Wellbutrin again, I got dry mouth. I wasn't having it with the meds that I was taking. I added Wellbutrin and I got the dry mouth, and I thought I would just have to deal with it. But a few weeks into it, the dry mouth resolved. And then I changed meds again, I added medication, and so now I have dry mouth again. So it's bothersome, but it can also rot your teeth. So it should be attended to. And again, it's a very, very common side effect. Hundreds of anticholinergic and sympathomimetic medications out there are xerogenic. Thank you for listening. Comments are always welcome.